My name is Brandon Smetana, and I'm an orthopedic hand, upper extremity, and nerve surgeon at the Indian Hand and Shoulder Center. The Nerve Injury and Limb Pain program was generated to directly serve a patient population that can be overlooked in Indiana, those with nerve injuries and nerve pain. Our profession's understanding of injury patterns, treatment options, and management strategies has evolved over time. Fewer providers in the community are trained to recognize and treat nerve disorders in the limbs, and patients can be left with few treatment options. We felt as though patients with upper and lower extremity nerve, brachial plexus, and spinal cord injuries, as well as amputees who have already developed or are at risk of developing limb pain and phantom limb sensations, were underserved in our community. Our goal was to develop and promote a multidisciplinary team to care for patients with these complex upper and lower extremity nerve injuries to better serve Hoosiers and the Midwest community. The Nerve Injury and Limb Pain program serves patients with both upper and lower extremity nerve injuries. We also treat patients with complex nerve injuries involving the brachial plexus and spinal cord in hopes of improving upper extremity function. Finally, we care for patients with both upper and lower extremity amputations in hopes of minimizing post-amputation limb pain and hypersensitivity, narcotic use, and phantom limb sensations, as well as assist with optimizing prosthetic fit and functionality. It became evident in our independent practices that a team-based approach would best serve patients with complex nerve injury patterns. From a physician's perspective, we're able to each converse with and examine the patient to better define the problems and treatment goals. Second, third, fourth, and sometimes fifth opinions are generated at each office visit, and the team-based model allows us to collaborate to combine our collective knowledge and expertise to generate an ideal treatment plan for patients depending on their individual goals. The collaborative model carries over to the operating room where we are able to assist each other in performing these highly technical surgical interventions in order to ensure the highest level of surgical care is delivered. Through partnering and integrating other services such as EMG and neuroconduction study testing, the Nerve Injury and Limb Pain program at the Indian Hand and Shoulder Center strives to provide complete care to those who may be affected by both physical and psychological limitations after their injury. We partner with regional prosthetic, physical therapy, psychiatric, and pain specialists to help optimize the global care and functionality for our patients. Amputees can experience debilitating pain that may lead to reliance on or addiction to strong pain medicines, can limit their use of prosthetic, hindering overall functionality, and cause significant psychological distress. Post-amputation pain may be felt at a single spot where a neuroma or painful nerve ending has formed and may zing up the residual limb or down to where the amputated limb was located. This can cause difficulty when touching the spot on the arm or leg, and even may cause hypersensitivity where it is even difficult to lightly touch the area, such as pulling the sheets over this spot when getting into bed. Phantom limb pain and sensations can occur when the brain believes the limb is still there. This leads amputees to feel a sensation of burning, tingling, numbness, and even pain in what was the amputated part, even though it is no longer there. Post-amputation pain and phantom limb sensations can be debilitating and can cause not only significant physical and psychological distress, but also limit the use of prosthetics and impede a patient from returning to functioning member of society. Treatment options or injured nerves during an amputation are successful at diminishing pain and phantom limb sensations, improving prosthetic use, and diminishing reliance on narcotics at any time point for amputees with post-amputation nerve pain. However, treatments are more effective if done at the same time or soon after the amputation occurs. We recommend amputees seek care as soon as possible to improve the likelihood of a successful outcome.